No, urology, we generally see more males,
right.
more males. Yeah, yeah.
Is that because of the prostate?
Yeah, because of the prostate, because of the penis, the testes, and
right.
things like that as well. Yeah, yeah.
Now, we'll open up our WhatsApp line in a second. We already have questions and comments coming through for our specialist urologist, Dr. Eneshra Padayachee. That number again, 071-613-7803. We would love to hear from you. In terms of kidney stones, that forms part of what you would look at as a urologist?
Absolutely. So that's the other thing that we see a lot of in our practice. There's a whole host of reasons why one would get kidney stones, but we see a lot of kidney stones we see a lot of kidney stones in my practice, basically.
And why would you say that? We are seeing an increase in patients presenting with kidney stones.
Well, again, it boils down to our habits. Our lack of water intake has got a huge causative factor.
So lack of water.
Lack of water.
So how much of water, in your opinion, should we be drinking on a daily basis?
Well, roughly about 1.5 to 2 liters of water. Okay, and they generally would say that how you know you're drinking enough water is if you look at your wee, basically, then it should be more clearer rather than yellow, basically.
We've spoken about this in the past, that a lot of people, they go to the loo and they just flush.
Yeah, yeah.
Our gastroenterologist was telling us, have a look.
Yeah, absolutely.
Because there's specific warning signs. So even if you go for a wee and you urinate, so you're saying look at the color because you can see a lot from it.
Yeah, absolutely. You can directly judge it. When patients come to my rooms with a little sample of the urine, I can tell you exactly how much of water that they've had, whether they're taking in enough or not, basically.
So if it's more deep yellow,
and orange, that means obviously they're not drinking a lot of water, basically. Yeah.
All right, interesting conversation tonight with our specialist urologist. Before we go to some of the questions on WhatsApp, Dr. Padayachee, does an inflamed prostate necessarily lead to prostate cancer, or is it prostate cancer totally separate?
No, it is a separate entity.
Right.
Okay, and there is no link between an inflamed prostate or prostatitis and prostate cancer.
So what are the warning signs? So if someone's listening and they may not have gone for a prostate check because there again some people feel because the physical digital test for that may make some people uncomfortable, but it's important that
one looks
at a certain age. Am I correct?
Absolutely. So 100% correct. A lot of the studies, the American Urology Association, the European Urology Association advocates that prostate screening should actually start from 40, and they've even looked and said that it should be started at about 38 years of age, basically.
Okay.
This should be combined with a blood test, which is known as the PSA yearly, and obviously the digital rectal examination as well.
So the digital rectal examination, which some people think they feel a bit iffy, but it's important to have that examination, right?
Absolutely.
Because you're feeling for something specific.
Absolutely. So the scary thing is that PSA is not an infallible investigation, and I always tell my patients you can't just have a PSA and if it's normal think that everything is all hunky-dory. You have to have a finger on the prostate, I've honestly seen normal slightly raised PSAs with an abnormal rectal examination, basically. That's the truth. It has to be combined.
And it could save your life.
Absolutely. So,
and it's really just a few seconds. I mean, I've had it done, and it's not as uncomfortable as one would think it is.
It really takes less than 10 seconds to be done. Yeah.
All right. That's in terms of a quick discussion on prostate cancer. We still have a few more questions for Dr. Padayachee, but I think quite a few people are chomping at the bit on WhatsApp here. So let me get off with one, which I don't think is really related to urology, but maybe you can guide me here. Good evening to everyone in the studio. Does dry gangrene, can it be corrected with surgery? My mother is diagnosed with DCM and has an EF of 10%. Thank you from Zitulele Patel, who's listening tonight. Doesn't sound like urology?
Not really. So dry gangrene generally affects either your extremities, like your legs or your fingers. DCM stands for dilated cardiomyopathy, and EF is the ejection fraction. I'm probably going to say that the patient needs to be seen by a physician or a surgeon for workup, basically.
All right, so a physician or a surgeon?
Or a surgeon, yes.
All right, thanks for that. Thanks, Zitulele, for for sending us that question. Good evening, Alan. I'd like to remain anonymous. I had a bladder lift 2 years ago, but I'm still in an awful lot of pain. I had a scope and a biopsy. Now I'm going to have G Botox injections on my bladder. Will this help with the pain? And how long does it take for the Botox to help?
Yeah, that's a good question. With regards to Botox, I think that G Botox is an error. It's actually Botox. It's Botox injections that's given into the bladder, and then generally what that actually does is that it actually paralyzes the bladder. Right. In terms of pain, I don't think that it will actually resolve the pain per se. But in terms of like leakage and things like that, it may help with the leakage. How long it lasts? Okay, we know that Botox generally lasts about 2 to 3 months before it has to be given again, basically. And the more Botox injections you have, the shorter the period of treatment is.
Now, I know you haven't seen Anonymous, she's not your patient, but would you recommend this type of the Botox treatment? Could that be a viable option? Because she's clearly had a bladder lift 2 years ago. She must have had some challenge.
Yes, yeah, absolutely. So she obviously has had some challenge. Look, Botox is one of the treatment options. Repeat surgery for these patients is always a challenge. It's never easy to sort of correct the pain, but I mean, I think having the Botox is definitely a viable option.